Healthy-ojas.com. Vital information for a healthier life.
Welcome to this video on diabetes herbs. Diabetes mellitus is a metabolic disorder of the endocrine system. Metabolism is the process of making energy from the food you eat. A metabolic disorder develops when there is any defect in this process. When this disorder develops, you might have an excess of some substance or shortage of others that you need to stay healthy. The metabolic disorder develops when the liver or pancreas does not function normally, like in the case of diabetes. Diabetes drugs are developed based on the medicinal herbs. Many conventional medicines have been derived and formed similar to a molecule in the traditional medicinal plants. For example, metformin, considered to be an effective oral glucose lowering agent, is developed based on the plant Garlica officinalis used to treat diabetes. Scientists form a molecule and its action similar to that of the natural herbal molecule. However, the human cannot match the millions of years of slow evaluation. So, natural made is always safe compared to human made things. Also, nature gifted us with this healing molecule packed with a perfect combination of other natural molecules to make it work at its best. However, humans try to isolate this molecule as a chemical, so its healing effect reduced, additionally with numerous side effects. Diabetes drugs develop resistance and side effects. Synthetic oral anti-diabetic agents have certain drawbacks, such as building resistance in the long run, adverse effects, and lack of action in a large segments of diabetes patients. Approximately 44% of diabetes patients develop resistance to sulfonylurea treatment within 6 years. Additionally, these oral agents are associated with adverse effects such as bloating, flatulence, diarrhea, and abdominal discomfort. Some anti-diabetic agents can cause toxic effects. For example, thiazolidinedione may cause liver toxicity, and sulfonylureas may worsen heart disease, cause hypoglycemia, and increase body weight. Many diabetes patients turn towards herbal treatment. The National Health Interview Survey found 22% of diabetes used herbal treatments. Plants provide hypoglycemic properties and traditionally used to prevent or treat diabetes. These plants additionally have the benefit of delaying diabetic complications, exhibits antioxidant activity, and lower blood pressure and cholesterol. 21. Diabetic herbs that lower blood sugar. As per ancient literature, more than 800 plants have anti-diabetic properties, and it indicates diabetes exists since the prehistoric age. List of 21 diabetic herbs are as below. 1. Allium cepa. Onion. Onion is a vegetable cultivated in China, India, America, Iran, Russia, Turkey, Egypt, and Pakistan. Anti-diabetic effect. It decreases fasting blood glucose level and improves glucose tolerance. Other medicinal uses. It helps reduce atherosclerosis, lower blood cholesterol levels, and prevent the formation of blood clot. How to use onion? Use this vegetable regularly in the cooking. Search for suitable recipes. Raw consumption is preferable. 2. Cuminum cyminum L. Cumin. Cumin seeds are grown in the Indian subcontinent, Northern Africa, Mexico, Chile, and China. Anti-diabetic activity. Studies show cumin can decrease the serum levels of insulin, fasting blood glucose, and glycosylated hemoglobin, and also inflammatory indices. Other medicinal uses. Studies show taking cumin seeds decrease creatinine and urea nitrogen. It possesses antioxidant, antimicrobial, anti-inflammatory, anti-cancer, and hypolipidemic property. How to use cumin seeds? Take 1.5 glass of water, boil the water, add 1 teaspoon cumin. Optionally, you can add stevia to sweeten. Reduce the flame heat, leave it for 10 minutes by closing the container with a lid. Filter and drink the tea every morning in an empty stomach. 3. Trigonella fenugreecum L. Fenugreek. Fenugreek grows in India, Morocco, Egypt, Ethiopia, and Turkey. Anti-diabetic activity. It slows down glucose and other simple carbohydrate absorptions. The study report shows it increases insulin secretion and peripheral glucose uptake. Other medicinal uses. It nourishes the digestive system, liver, promotes respiratory health and lower cholesterol levels. How to use fenugreek. Clean and soak 1 or 2 teaspoons of fenugreek seeds in the night. Next morning, eat the fenugreek and drink the liquid in an empty stomach. 4. Aloe vera. It grows in USA, Mexico, India, Australia and Africa. The aloe vera leaf gel contains about 98% water. Balance 2% includes the magical healing compound. Anti-diabetic activity. It improves the body tissue's response towards insulin, thereby making insulin more productive and help lower blood glucose levels in diabetes. Other medicinal uses. It has been used for constipation, skin problems, worm or fungal infection, colic, lower blood pressure and improves cholesterol levels. How to use aloe vera. Clean aloe vera leaf, cut the spikes in the sides, remove the skin, wash the gel in a running water to remove the yellow sap and cut the gel to eat or grind the gel to drink. Alternatively, get the readily available juice and drink it as per their suggested dosage. 5. Cinnamonum verum. Cinnamon. The cinnamon stick is a spice cultivated in Sri Lanka, Brazil, Caribbean, India, Indonesia, Vietnam, China and Burma. Traditionally used for blood sugar and cholesterol management. Anti-diabetic property. It improves the insulin signaling pathway. It increases insulin receptors that improves insulin sensitivity and glucose entry into the cells. Other medicinal uses. It is a warming circulatory tonic as well as digestive aid to soothe upset stomach, gas, bloating and occasional indigestion. How to use cinnamon. Take 1/2 glass of water, boil the water, break the cinnamon stick into pieces. Optionally, you can add a few stevia leaves to sweeten. Reduce the flame, heat, leave it for 10 minutes. By closing the container with a lid, filter and drink the tea every morning in an empty stomach or in between meals. 6. Ocimum sanctum. Holy basil or dulci. Basil is indigenous to India. In the Ayurveda system, it is often referred to as elixir of life for its healing power. It can treat many different common health conditions. Anti-diabetic effects. It stimulates insulin secretion from pancreatic beta cell. It possesses hypoglycemic and hypolipidemic effects. Other medicinal uses. It is useful for asthma, colds, flu, sinusitis, high blood pressure, high cholesterol, aches, indigestion, ulcers and intestinal parasites. How to use dulci. Just eat 5 to 6 fresh leaves first time in the morning. Alternatively, prepare dulci tea using dried leaves or take a dulci capsule. 7. Ginseng. The root is grown across the northeastern United States, China and Korea. It is an herb trusted for over 5,000 years for its ability to promote vigor. Anti-diabetic activity. Studies have shown that ginseng increases insulin production and reduces cell death in pancreatic beta cell. Ginseng supplementation show improvement of blood glucose concentration with significant reduction in serum insulin levels. Other medicinal uses. It promotes vigor, nourishes the nervous system, enhances hormonal secretion, helps lower cholesterol and increases immunity. How to use ginseng. 1/2 to 1 teaspoon of root powder, swallow with water. Alternatively, prepare a tea and drink. 8. Mangifero indica. Mango. Mango producing countries include India, China, Thailand, Mexico, Pakistan, Philippines, Indonesia, Brazil, Nigeria and Egypt. Anti-diabetic activity. It is used as an anti-diabetic agent in Nigerian folk medicine. The study shows its leaves inhibit alpha amylase activity and thus reduces postprandial hyperglycemia. It also improves glucose uptake by the skeletal muscles, adipose tissues and liver. Other medicinal uses. Lowers blood pressure, fight anxiety, treat gall and kidney stones, cure respiratory problems, treat dysentery and as a stomach tonic. How to take mango leaves. Put 4 to 5 tender mango leaves in hot water. Close the container with a lid and leave it overnight. The next morning, filter and drink the liquid on an empty stomach. 9. Psidium gaujava lin. Goa. It is grown in India, China, Thailand, Mexico, Central and South America. Anti-diabetic properties. Traditionally used for the treatment of diabetes in East Asia and other countries. It inhibits various enzymes that convert carbohydrate into glucose in the digestive tract, thus lower postprandial blood glucose spikes. It also improves hyperinsulinemia. In Japan, guava leaf tea, Bansuri cha, containing the guava leaf extract has been approved and is now commercially available. Other medicinal uses. It also possesses antioxidant, hepatoprotective, anti-allergy, antimicrobial, cardioactive, anti-cough and anti-inflammatory. It also improves triglyceride and cholesterol levels. How to take guava leaves. Clean 4 to 5 leaves of guava in a running water, cut it into pieces. Optionally, you can add stevia to sweeten. Put these into 2 cups of boiling water. Minimize the flame, heat, leave it for 5 minutes by closing the container with a lid. Filter the content and drink the tea. 10. Catharanthus rosas, Nitya Kalyani. It is grown widely in India, Malaysia, Spain, Nigeria, West Indies, United States and China for its pharmaceutical compound. Anti-diabetic effect. It is probably enhancing the secretion of insulin from the beta cells or through an extra pancreatic mechanism. Other medicinal uses. Traditionally used for relieving muscle pain and depression of the central nervous system. In Malaysia, Nigeria and West Indies, the plant used for tackling hypertension, diabetes and insomnia. 2 anti-cancer medicines, Oncovin and Welban, derived from it, which are sold for $100 million per year. How to use its flower. Take 1½ glass of water, boil it, add 3 to 5 flowers, fresh or dried. Optionally, you can add few stevia leaves to sweeten. Reduce the flame, heat, leave it for 10 minutes by closing the container with a lid. Filter and drink the tea every morning in an empty stomach. 11. Cassia auriculata, Avarambu. It is grown in India, Myanmar, Sri Lanka and in several African countries. Anti-diabetic activity. Traditionally has been used to treat diabetes. It boosts insulin level in the body naturally. The study suggests it possesses insulinogenic action through pancreatic as well as extrapancreatic. Other medicinal uses. It is used in disorders of the gastrointestinal tract, improve liver function and rectifies constipation. It is also helpful for joint and muscle pain, rheumatism and urinary tract disorders. How to use its flower. Take 1½ glass of water, boil the water, add 3 to 5 flowers, fresh or dried. Optionally, you can add few stevia leaves to sweeten. Reduce the flame, heat, leave it for 10 minutes by closing the container with a lid. Filter and drink the tea every morning in an empty stomach. 12. Eugenia jambolana, jamun. It grown in Indian subcontinent, Asia, Africa and South America. Anti-diabetic activity. Traditionally, its leaves, berries and seeds used as a viable herb for treating diabetes. It possesses anti-hyperglycemic and antioxidant property. It reduces fasting blood sugar, raises superoxide dismutase and reduces HOMA-IR, insulin resistance. Its anti-diabetic activity appears to be both pancreatic by stimulating the release of insulin and extrapancreatic by directly acting on the tissue. Other medicinal uses. It is also useful to improve blood cholesterol, flatulence, intestinal gas, gastritis, stomach inflammation, constipation, diarrhea and liver disorders. How to take jamun seeds. Take 1 teaspoon of seed powder, put it into your mouth and swallow with water 15 minutes before food. Do it twice a day for maximum health benefits. 13. Ego marmalus, bilwa, ball. It grown in India, Sri Lanka, Pakistan, Bangladesh, Burma, Thailand and other Asian countries. Anti-diabetic activity. In an animal study, it enhances the generation of beta cell. fruit extract had hypoglycemic activity. This effect may attribute to its antioxidant activity and its high content of active constituents. Other medicinal uses. Its fruits and leaves improve digestion and reduce urea. It possesses anti-ulcer, antioxidant, anti-malarial, anti-inflammatory, anti-cancer, radioprotective, antifungal, antibacterial, antiviral and cholesterol-lowering properties. How to use its fruits or leaves. Dried fruits are available in the market. Take 2 to 3 pieces and increase as per your requirement based on your blood sugar control. Take 1 teaspoon of dried leaf powder and swallow with a glass of water. 14. Xenia grandis. Ivy gourd. It is a vegetable widely cultivated in China, Cambodia, Myanmar and Africa. Anti-diabetic activity. The ingredients present in it act like insulin as well as insulin sensitizer that help control hyperglycemia in diabetes. Other medicinal uses. It possesses anti-inflammatory, antioxidant properties. It protects against plaque formation and thus to some extent it may prevent heart diseases and strokes. How to use ivy gourd. You can cook the vegetable twice weekly. Search for various recipes. Take 1 teaspoon of leaf powder with warm water or prepare tea and drink. 15. Momordia charandia. Bitter gourd or bitter melon. It is a bitter tasting vegetable, thus got this name. It is grown in India, Malaysia, China, Africa, the Middle East, the United States and Thailand. Anti-diabetic activity. It contains insulin-like a compound that causes more glucose to enter the cells, thus help lower blood sugar levels. It is believed to increase glucose consumption by the cells, improves glucose tolerance and decrease hepatic glucose production. Other medicinal uses. Traditionally used as anti-cancer, anti-inflammation, antivirus and cholesterol lowering effects. How to use bitter melon. You can cook the vegetable twice weekly. Search for various recipes. Alternatively, take 1 teaspoon of leaf powder and swallow with warm water or prepare tea and drink. 16. Salacia oblonga. It grows in Sri Lanka, India, China and other Southeast Asian countries. Anti-diabetic activity. Traditionally, its roots and stems are used for blood glucose management, useful for type 2 diabetes management and also beneficial for type 1 diabetes. It inhibits alpha-glucosidase and alpha-pancreatic amylase activity and decreases postprandial glucose. It increases the uptake of free fatty acid, FFA, thus reduce plasma FFA and insulin resistance. It increases glucose uptake by the liver and skeletal muscles and decreases plasma glucose levels. Other medicinal uses. Its bark is useful for treating diarrhea, fever, arthritis, gonorrhea and skin disease. How to use its root bark. Grind it into a powder. Take half to 1 teaspoon daily or a comparable amount of extract with a glass of water. 17. Gymnema Sylvestre. It grows in the tropical forests of central, western and southern India and the tropical areas of Africa, Australia and China. Anti-diabetic activity. It is nicknamed as a sugar destroyer because it destroys the sweet taste by masking the sweet taste buds in the tongue. It increases insulin secretion and glucose utilization, promotes islet cell regeneration and inhibits glucose absorption by the intestine. Other medicinal uses. It also possesses antimicrobial, cholesterol lowering and hepatoprotective properties. How to use its leaves. Grind it into a powder. Take half to 1 teaspoon daily or a comparable amount of extract with a glass of water. 18. Scopeadulcis. It is grown in America, Asia and Africa. Anti-diabetic activity. It appears to reduce blood and urine sugar gradually. Also not drop below average, so it will not cause hypoglycemia. Other medicinal uses. It is useful for digestive problems, kidney stones, pulmonary conditions, fever, hypertension, hemorrhoids, diarrhea, dysentery, anemia, albuminuria and diabetes. How to use it. Grind the whole plant and take a teaspoon powder, swallow with water or boil it to get a tea to drink. 19. Portulaca oleracea L. It grows in southern Europe, Mediterranean countries, North Africa, Middle East and Asia. It contains 5 times high omega-3 fatty acids than spinach. It is famous as a traditional medicine in China for the treatment of hypertension and diabetes. Anti-diabetic activities. It increases insulin sensitivity, alleviates insulin resistance, and improves impaired glucose tolerance and lipid metabolism. Other medicinal uses. It possesses antioxidant, anti-hyperglycemic, anti-hyperlipidemic, renoprotective and hepatoprotective. It also treats headaches, intestinal problems, liver, stomach, cough, shortness of breath and arthritis. How to use it? It is a component of green salad and its soft stem and leaves used raw, alone or with other greens. Search for various healthy recipes. 20. Silybum marianum, milk thistle. It is grown in Europe, America, Australia, Africa, Egypt, India and China. Anti-diabetic activity. In patients with diabetes and alcoholic liver cirrhosis, milk thistle for 6 months produced significant reduction in fasting blood glucose, mean daily glucose levels and insulin requirement was also dropped by 20%. Other medicinal uses. It helps reduce several diabetes complications such as diabetic neuropathy, diabetic nephropathy and non-alcoholic steatohepatitis, mainly through its antioxidant property. How to use its leaves, seeds. Eat its leaves and flowers as a vegetable for salads and a substitute for spinach. Eat the fresh ground seeds or get a good quality capsule. If using the seeds, buy them whole and then grind them as needed. Roast the seeds for the use as a coffee substitute. 21. Opuntia streptocantha, nopal. American Indians use prickly pear juice to treat burns and it has a long history in traditional Mexican folk medicine for treating diabetes. Anti-diabetic activity. Cactus pear fruit can lower high blood glucose levels as well as maintain normal levels by decreasing intestinal absorption of glucose. Fiber and pectin in the fruit may be responsible for this activity. Other medicinal uses. Also used in treating lipid disorders. It lowers cholesterol levels, aids in weight loss, improve digestion, boost immunity, reduce inflammation, lower Alzheimer's risk and heals ulcers. How to use its fruits, shoots. Consume the tender young part of the cactus stem as a vegetable in salads. Consume the cactus pear fruit as fresh. Is it okay to take the herbs for an extended period? In Ayurveda, mostly treatment period would be for 41 days. Also, it is not advisable to take any medicine, including herbs, for an extended period for years or a lifetime. However, you can choose a set of some herbs that are effective for you and rotate its use every month to enjoy the benefit without any harmful side effects. Allium cepa is perfectly okay to use daily without any restriction. Ivy-gourd, bitter-gourd and milk thistle can be used as vegetables weekly once or twice. Cumin seeds, cinnamon sticks and ginseng roots as tea separately or in combination for better blood sugar effects. Guava and mango leaf tea can be taken daily, individually or as a combination. Change or modify the tea recipe for every month. You can also consume other herbs as directed in a cyclic rotation. The word of caution. Please include one herb at a time, use it at least for a week and test blood sugar to know how your body reacts to it. Then slowly add next herb and so on until you reach your target. Can I take diabetes herb along with my regular medicine, drug? You can take diabetes herbs along with your drugs. However, you should be more vigilant because you may end up in a low blood sugar, hypo. Also, some herbs may interfere with your drugs and it might increase or decrease its effectiveness or worsen the side effect. Co-administration of conventional drug and herbal medicine may cause potential interactions that leads to adverse effects. So, get a doctor's consent before starting herbal treatment. So, you need to do enough research by taking into account the health problems you have and the drugs you are on before start taking herbs. Are herbs available in the market safe to consume? There is no single definite answer to this. because it depends upon the supplier. So you should be more vigilant and analyze the supplier by going through reviews by fellow users. Also, you should be cautious whether the reviews are genuine. It is always preferable to have herbs by taking decoction by boiling it in a low flame for an extended period, because this helps to destroy any microorganisms in the herbs while processing. Are there any side effects of diabetes herbs? Generally, most of the herbs suggested here are safe to use. However, diabetes herbs contain natural chemicals that may interfere with your medications and may cause untoward symptoms. Also, taking too much of certain herbs may cause adverse effects. For example, taking a large quantity of bitter gourd juice daily in an empty stomach can upset your stomach. However, if you take it as per the recommended amount 100 ml and frequency 2 to 3 times a week, this will not cause any side effect. So take herbs after doing enough research and practice limit in quantity and frequency. Also cyclically rotate the herbs used for every 30 days. That is, a set of herbs for a month, next set for the next month, and so on, and you can repeat the same set in the cyclic manner. That's all from today's episode. Hope I have explained the diabetes herbs to your satisfaction. My humble request to all, please like and share this video as much as possible. It motivates me to take more awesome videos for you. Please press the thumbs up button. Also share it with your friends. I request you to share the thoughts and questions as a comment. I will read every comment and answer your questions or take your suggestions. If you want more video from me, please subscribe to this channel. Thank you for watching this video, and I will meet you soon with another exciting video. Until then, goodbye.